Good afternoon, ladies and gentlemen. Thank you for coming back because it's really good weather, but I'm very happy that you're back to this maybe a bit strange session, because first sessions of the Melody workshop were more related with well-known endpoints, whereas this session is more on something which can be important from irradiation exposure till the late effects of this exposure. We have seen already in a few talks how to advance this. Some references to immune effects, but this session we will try to give an overview of these different things. So, what is the relevance of the immune system? So here I tried to make a graphical presentation of where it should fit in the research. So we have a human population that can be exposed to one dose, which can be a high dose, or it can be a long-term small dose, and we have some healthy people, we have people which are not too healthy, we have patients. And what is the role of the immune system if we have exposure of this ionizing radiation? In short term, or by persistent changes in humans. And so what do we want to know is how many people will get adverse effects which can lead to really diseases, or which ones are more or less affected and which do not react. So that's what we want to know. If we have ionizing radiation, how will this affect the health? And vice versa. How does the status of the immune system or immune diseases influence the radiosensitivity? Now, thinking about adverse outcome pathways, we can situate the immune system in this scheme from exposure to the outcome. First, we have development of ROS cytokines that can be liberated, radioactive RNS. Then NF-kappa B is one of the molecules that can be produced by this. And this can lead to immune activation, but the immune system has a pivotal role, and we will see this probably also in some of the talks, also immune desactivation. And by doing so, if there is an immune activation, there can be a way back to production of more ROS, and in this way, a vicious circle can be created. And that is the importance of studying the immune system. So we need that to clarify the late off-target and systemic responses that can be induced by low doses of ionizing radiation. The info available, we tried to structure the session a little bit like the previous ones, but it is difficult because in this session we do not have so much info available, certainly not about epidemiological studies. So we had to invent a bit how we do it. But in fact, on its own, it is interesting to see that this is missing and how we can see how we can learn about more about the immune system. There are some clinical or subclinical observations, but most work for the immune system is available from experimental models, from systems biology, bioinformatics, and from mechanistic approaches. Here is an overview of the session, and first of all, I would like to thank all the speakers that are here in this session, because it's not so easy, this session. Especially also the external experts that are not belonging to the Melody community, because I really think that it is very important that we learn from real experts that know more than we do on the immune system, to bring in this knowledge in our community. And I really look forward to learn from you, but also maybe for further collaborations. So we start with Olga Martin from Australia, who will give a talk on a functional immune system that is required for systemic genotoxic effects of localized ionizing radiation.